One of the most common treatments for sciatica is the epidural steroid injection. There are 3 different types of epidurals, and today I'm just going to very quickly take you through each one of them so you can understand what it's all about. The most commonly performed epidural is called a transforaminal. What is that? So if you were to look at this model from the side, so this is the lower back, looking at it from the side, you can see that here's the L4 bone and here's the L5 bone. Between the 2 bones, you have this opening called the foramen. You can think of it like an exit ramp. And through this exit ramp, you see this yellow nerve coming out. So this is the spinal nerve. So for a transforaminal epidural steroid injection, basically what you do is you come through the side of the spine using x-rays and stick a needle right over here at this spot, right next to the nerve. And after localizing with an x-ray, making sure you're at the correct spot, you inject a mixture of a steroid and usually lidocaine at this location. This injection is usually very successful and typically takes between 3 to 10 days to kick in. And you can get an epidural steroid injection through the transforaminal technique very safely, and people do this all the time. The second technique is called the interlaminar epidural. What is that? So if I was to rotate the spine, so you're looking at it from the back, here's the L4 vertebra, and in particular, this is the lamina of L4, and here's the L5 vertebra, or the lamina of L5. And if you look carefully, there's a space between L4 and L5 right over here. This is called the interlaminar space. So for a interlaminar injection, you come through directly the back of the spine, and you stick a needle right over here under x-ray, and you inject the medication over here. The advantage of the interlaminar is that you can inject a larger volume of medication compared to the transforaminal injection where you're coming through the foramen. So sometimes for technical reasons, you may want to do an interlaminar injection, and at other times you may want to do a transforaminal injection. The third major way of doing an epidural injection is called the caudal injection. This technique is a little bit different. Basically, what you do is you inject the tip of the tailbone. So if you look at the spine directly from behind, you can see that there is this opening right over here. It's called the sacral hiatus. The advantage of this technique is that you can insert a catheter and take it all the way up the spine, and you can inject a very large volume. And this technique is especially suited to those patients who previously had a surgery done to the lower back. So there's a lot of scar. And obviously, when you have a lot of scar, it can be difficult to assess if you're next to a nerve or if you're directly in the nerve, which certainly you don't want to do. So the caudal injection is a very safe way of injecting steroid into the spine. So I hope you found this video helpful. If you have any questions, please feel free to share in the comments below. Thank you for watching, and see you next time.